6:38. It is the 23rd day of April. Over 40 days under mandatory social isolation and lockdown orders. Now the conversation turning to reopening the island, but only after we have conducted community testing. We spoke with several mayors yesterday. They got the word, right, Bree, that where community testing will take place, at least in a couple villages, but they might have got the where, they haven't got the when yet.
Right, and they're all working with the Mayor's Council of Guam President, Melissa Savaras, and actually she's going to be the pilot program for the community testing this Saturday, and I believe we have her on the phone now.
Yeah, we do. So good morning, Mayor.
Good morning.
Hi.
So just about 1.5 million questions rolling in about this Astumbo pilot program testing.
Yeah.
Mayor, I guess just take us to where we're at now with the current status, what you're working on, and what it's going to look like Saturday, 9 a.m.
Yeah. So, the community testing is going to be for the immediate community around the gym area. So, it's to target the immediate neighborhood. Of course, during any type of outreach, they bring outreaches into the community where people have limited access to health care. So this is going to address those families or individuals who feel that they need to get tested because they have some mild symptoms, and they'll be able to have access to that.
Mayor, now you said that it was for the immediate Astumbo. The immediate. Can you just be a little more specific on what you mean by that? So does that mean that only people from that area will be able to go and get tested?
So like I said, this is a limited outreach for, they want to do community outreach and community testing. So the target to go out for public health going out into the community is to give access to to residents who cannot, say, drive to a private clinic, a health care center, or to the northern or southern health center. They maybe because of lack of transportation. So this community outreach, from what I'm understanding with Department of Public Health, will be addressing the immediate neighborhood. So the Sagan Linazan area is the area that they're going to address because that's the area immediately surrounding the gym.
And how many residents are in that area, in the Sagan Linazan area?
There's 80 homes from the Sagan Linazan area, and so we're the public health team. They're called their ECHO team. Will be canvassing the area starting this morning. They were preparing flyers. They just needed to finalize some information on the flyers, just indicating to the residents that if you have mild symptoms that you would like to, and there'll be a list of symptoms on the flyer. There'll be opportunity for screening, community screening at the gym on Saturday between 9 a.m. to 12 noon.
Mayor, I think in the press conference, Linda had said something that there would be a drive-up option and then also a walk-up option. Is that still accurate?
Yes, it's still accurate.
And then what are the flyers that they're passing out? Are those in English, or are they broken down into different languages maybe?
The one that I saw is in English, and then we do have some translators that will be. We were able to connect with some Tupi translators. We have some Chamorro speaking, and then of course Tagalog.
You said 80 homes. How many people does that equate to? Break down to?
Sabrina, some of these homes have multiple families, 2-3 generations of families living in these homes. So roughly about maybe about 400 or 500 people. Of course, not everybody's going to get tested, right?
Is that the goal, though, Mayor, to get everybody there tested?
Well, those that feel that are interested in getting tested, of course, like I had mentioned to Public Health yesterday, because we have multiple families, family units living in these households, you have two, three generations, parents, grandparents, and children.
Mhm.
So, which age group would you be more concerned about? Those that are 40 and over, 50 and over? Of course, those elderly, but if they're not uh, asymptomatic, then of course they don't. And everything is with voluntary testing, screening.
Saginaw Lanazan, it's a pretty dense community. The homes are small, they're really close together. And what is the plan if you have one household that has a high number of positives, and they're not big homes, they're really small.
They are very small.
Right. So what's the plan if you have a household or you have like one or two people that test positive in that home? How do you isolate them and not have them have contact with other people in that same house? And if we're looking at, let's say it's 400, 500, say they test 200, where are we going to put all these people?
Well, of course, Sabrina, Public Health has their surveillance team. They would address it if those concerns come up. I believe.
But they hadn't presented that sort of contingency plan to.
Well, I know in the press conference
that's
yesterday,
got to be concerning.
Linda had said that if your home doesn't meet CDC guidelines, then they're going to put you in the government isolation facility.
Well, it depends on how many rooms are at the government isolation facility.
Right, and then would they then put if we have a house of a family, maybe like 7 or 8. 3 of them test positive. Yeah, I wonder logistically, are they going to take those 3 and put them in the isolation facility and then have I don't know. Obviously, they're still kind of working through these things, right, Mayor?
Yeah, obviously. So I have, they want to do community-based testing as mayors, and I've spoken to my colleagues. Our facilities are available, and so that's our part, is that we make the facilities available, okay?
But they're not going to go inside the gym, are they?
No,
everything is outside. Okay, there's no need.
What we've done, especially at the gym, is because it's community based, right? There's people that don't have transportation. We've already made lines, social distancing lines, on the 6 feet apart.
Right.
So you're not going to hang up against the wall and have your conversations with they'll be distancing in the walking lines as well.
So for residents in Saginaw Lanazan that want to go to the testing site, what do they need to have IDs with them, masks on?
Everybody must have a mask on. We see most people walking around, driving around, even with the mask. So that would be, of course, very important. You must have a mask. I'll hand you a mask if you.
So you have some masks for those people who don't have them, can't afford it.
Right.
What about people with disabilities that can't make it there? Are we going to see Public Health go to their homes and test them?
If they live within the testing area, yes.
Okay.
Mayor, what are your constituents saying about wanting to get tested? Or what are you hearing? Is this something that they want to do, or are we having a hard time? Is there any fear of the doctor going on?
People that call our offices, and this is throughout the island. Whenever because I get calls from mayors every day. Somebody wants to get tested. After my meeting yesterday, I got a call and said, well, the people in another village want to drive all the way up to Dededo on Saturday morning. So I told them, if they're really adamant about getting tested, they can drive to any health center, northern or southern, and somebody will be at the front to screen them. And then if they meet the criteria, they will be swabbed. They can also go if they have a private physician. Private clinics are also doing testing. So there's no. We're not saying that you can only come to these outreaches to do your testing. You can go to any community health center, which is Northern and Southern Public Health. Come drive to the front. Say you want to get tested. There is a questionnaire that the nurses or the staff would ask, and then if you meet those criteria, then of course you're going to get tested. So.
Right, I get it. This is for the most vulnerable population,
Right,
people
yeah.
who don't have the ability to travel. So you guys are bringing this clinic to them.
We're working on the messaging, Mayor. I think when the governor is out there saying that we want to test so many people, we want to test 258 people a day. People hear that, they automatically think I'm going to go get tested. When they hear that we're going to do a pilot program in Astumbo, and the messaging is that we want to test so many people. Of course, people are thinking they can just go show up at Astumbo, because I believe in one of the press conferences they might have even said that.
Yeah, right. So, like I said, as mayors, we're here to provide the facility in the areas that are, that they want to do. And so I'm doing a pilot. And so I continue to hear at the press conferences that it'll be community-based testing. And then, when we come to the table through these meetings, I'm hearing, well, it's going to be this particular housing area, and then how much can we do around it. So of course we have the team that will be going out with under a team of nurses that will be going out to do, and these are nurses that go out anyways for Project Pasita. They do community-based checks on.
So they're familiar.
They've done
They're
this.
familiar with the families
I
that
got
live
you.
there. Yeah, they're familiar with the families that live there. So they're not, they're not new to this. These are neighborhoods that they usually work in anyways.
What about so this is the pilot project, but obviously Dededo is the largest village on Guam. So where else are they looking at conducting this community testing?
I know that they also want to hit like Tigo.
Right. I meant specifically in Dededo.
Yeah. Specifically in Dededo, I think this would be the one area in Dededo, because there's a facility. One thing that they look at is there a facility where they can bring stuff into a room? Of course, the people coming are driving through or walking through. They do their business, walk in, do their business, and leave. So, you need to make sure that, but the people that are swabbing or working and, directly asking questions, they're there for 3 hours, 4 hours. Are there restroom facilities for these individuals that are doing these testing or surveillance or whatever it is that they're going to do? So they need to make sure that if they're going to go into a village, we're not going to intrude in somebody's home or garage and say, hey, we're going to do this in here. Can we use your toilets? Can we use your garage? Can we use your living room to store the coolers or whatever? They need to make sure it's a common area where their facilities are available for the people that are going to be doing this task. So most of those areas are areas where mayors have facilities. Department of Parks and Rec has a facility in these areas. That kind of stuff, right?
Yeah, but you also have areas that you don't have facilities, like Swamp Road. That's a pretty long stretch of road. I mean, how is that one of the areas that have been identified that they were looking at?
It's not an area that has been identified, but Swamp Road is in pretty close proximity to Dededo Public Health.
Mayor, we spoke with Mayor Sasuico and Mayor Matanani yesterday morning, and both of them have been told about where community testing will take place in their respective villages. They expressed a little frustration, though, about not knowing when community testing will take place, because, as I'm sure you know, when we put out this information, people hear it, they want to start planning to get tested. So have you heard anything else about any other timelines for any other community testing in any other villages?
I don't have a timeline for the other villages, and I'll tell you, I speak to my colleagues all the time.
Right.
Mayor Sasuico and Mayor Matsunani, and of course, because they too are anxious. I mean, even the PD mayor, who's not scheduled yet, has said, oh, they're going to drive to Astumbo, so just tell them that the mall is closed, because when they drive up, there's nowhere else for them to. There's no other places, and so because it's community, so as far as the timeline and when they're going to go, I don't have a schedule.
Okay. I did want to ask about the results. Did they tell you that they were going to be giving the results there? Because those those Abbott ID Now tests, they are, mobile, and they can spit out results within X amount of minutes. Did they tell you that they would be getting the results on site or compiling it and announcing it later that evening?
Yeah, well, announcing it later. What it is I know that how they're going to do it is put the specimen in the containers and then take it to the lab. So somebody from the lab will be there to transport. I don't know how often. Are they going to do it every hour or, whatever? So there will be somebody from the lab to take the specimens and take it to the lab to get tested.
Mm-hmm. Did they say which lab? GRMC or public health? Or
I'm not clear. I
Okay.
heard I didn't know which particular lab though. Okay?
Okay. Anything else you wanted to get out to the community about the testing this Saturday?
No, just keep reminding people that, if they really, really feel that they need to get tested, there are other facilities
Mhm.
that they can drive up to.
Right. Yeah, that's what we're trying to do, Mayor. To change the message. The message has been
Yeah.
stay home. Now the message is go get tested.
Yeah,
It's-
if they
it's
feel
free.
that it's necessary. If it's free, if they feel it's necessary.
Mhm.
Okay, so and you're kind of doing the same thing, right? I know that you're close with your constituents. Are you going out here and then telling people like, hey, we got to get tested. If you want to reopen the island, we got to get tested.
Yeah, of course. As a matter of fact, my staff who deliver meals to the Manamkos,
Right.
I just told them yesterday I wanted them to get tested, and they looked at me like, but we don't come in direct contact. They're giving through bags, through doors, and so as long as they don't feel any symptoms, I'm not going to push it.
Right.
Mhm.
But of course, like you said, we want to reopen the island.
Mhm.
Yeah.
There was one thing that you had requested actually during when the dashboard was released and the information that you guys received. You were looking a little bit more for specifics in terms of Dededo is really huge. Which neighborhood are the positives in? Are you aware of Sagan-Linazan if there are positive cases there?
I'm not aware of any positive in Sagalinadan, but we do have. I only because we've helped transport patients back home in the outskirts of the village, outside of the Sagalinadan area, and it's like one or two that I know of.
Mhm. Okay, but a majority of them have recovered.
Oh yeah,
in
yeah.
your
More
village.
than half of ours
Right.
have
Are
recovered.
they recovered, Mayor? Do you trust the recovery criteria? Because I heard something in the press conference that it kind of just caught my ear, and that the Roosevelt sailors, the Navy wants to keep them here a week longer than the 14-day period because they just want to be really sure that when they go out to sea that the virus doesn't pop up again. So I kind of thought, well, if the military is adding an extra week onto it, and the CDC guidelines are what they are we now going to maybe do that as some kind of precaution, or are we just going to keep churning recoveries out?
The individual. I mean, I've actually transported 2 people home, and they said, you know what, we need to remember to hygiene, washing, all these kind of things.
Right.
Wearing the mask all the time. They said that's something they'll never take for granted anymore,
Mm-hmm.
and always have to do. So,
Yeah.
they've recovered. They know what it feels like to be there in that area, that condition. So,
Right.
everyone would be. They said they wouldn't even wish that against their enemy.
Wow.
By any chance, do you have a copy of this brochure, or
Yeah,
can take
Mayor.
a picture of it, and we can just be reading it on the air?
Yeah, just to get the word out. We want to
Yeah.
help.
Yeah. As soon as they because they just needed to change the location
Okay.
on the flyer. As soon as they send that to me, I'll send it to you.
Mayor, I just wanted to ask because a lot of people thought that they were going to be getting the stimulus checks by now. A lot of people thought that they were going to be getting the unemployment assistance by now, and we actually find out that that's weeks away, maybe even a month away for the unemployment. And people were told to hang in there. They were told to apply for food stamps. Dededo being the most populated village, what are you seeing in terms of people really just now hitting a new rock bottom? With the grab-and-go meals, with the various assistants out there, are your constituents in a new world of hurt because we're not getting the help that we thought was going to be here by now?
Chris, every day I have 2 staff that are working in the office. We're only taking phone calls, and we're sending, but we've seen an increase of public assistance applicants. Of course, they have to drop boxes, and we've been actually printing out the application for the tax thing, so the stimulus. So a lot of people who are either farmers or unemployed, you know, people they've actually or didn't file. They've been picking up these forms from us, and so you know, they honk the horn, and we know because they called already. We know who they are. We run the form out to them, and then they leave. And they, you know, they ask for an extra copy because what they do is, you know, they have to drop one and keep one. So we've seen an increase in that, but most especially the increase on people applying for public assistance through public health, Catholic Social Services, Salvation Army.
Mayor, are you seeing, because I was getting some comments on this last night and even on our stream, are you seeing that there are people who are, you know, haven't been working, but for whatever reason don't meet that criteria for public assistance? Because what I'm hearing is there's a lot of people who need help, but just don't qualify for that. But that doesn't mean they're, you know, Donald Trumping or they're balling, you know.
Right. Well, the ones that, you know, that have called us that they don't qualify for food stamp because, you know, they're looking at the, you know, they have assets.
Right.
They have assets, and probably those are some of the reasons why they don't qualify, because part of it is you sell your assets, and of course people are not going to do that.
Right.
And so what they're doing is they're at least applying for food supplements through CSS and Salvation Army. And so, you know, we're asking, you know, we have some toiletries that were donated to our office, and so we ask, do you need toiletries? Do you need, you know, hygiene stuff? Because we have that.
Right.
And I mean, we don't have a store, but, you know, we have things, a tube here and a couple of bars of soap here and shampoo. So we're giving those out to residents who actually have expressed their concerns with us.
Right. But maybe
so they'll drive up and we'll have a bag up front.
Right. That's very good. Very good. You see the grab and go meals. What is that like when, you know, I got a message yesterday that, you know, people line up early to get these meals because, it, you know, for a lot of them, it's the only way they're going to eat.
Well, you know, when you have children at home, and it's not just for school-age children, it's 0 to 18, and you don't have to be a public school student. So, you know, we see more families taking advantage of it. The good thing is that people in line are able to get, because unlike the beginning of the grab-and-go meal, people were leaving with 15, you know, 20 boxes of meals. Now the per car is limited to 10, so that everybody in the line can get something. So, you know, I think it's going well. You know, families are getting their meals, children are eating, and on several occasions when they've had leftovers, they've called us and said, you know, what can you help us distribute this? And
right.
We've taken it to Pacific Gardens and Titano Apartments along Machechi Avenue. We've taken it to the middle of Nevermind Road and Swamp Road.
Wow, Mayor. So when you go into these areas with these meals, what's the response? Because I'm getting the visual in my head. It's like kind of an ice cream truck.
Well, kind of an ice cream truck is correct.
Right.
Because what we do is my guys would turn on their siren. I would honk my horn and I'll just drive through. I said, do you have kids in there? And, you know, and then they run just to the edge of their property, and I'll get out and we'll just give it to them. Wow. How many kids you have? You give six, you know? Mm-hmm. But, I mean, and that's only very limited to very few times that they actually have leftovers.
Right,
because most of the time, it's actually, everything is taken by the end of the day.
Right.
But very rare where, you know, you don't see days when sometimes, very rare. I think only maybe 3-4 times that this has happened since the beginning.
Yeah.
Yeah.
Well, Mayor, you know, we've had your colleagues and you call for transparency, and I think that they should have some kind of briefing. I know we're doing the community testing where they bring you guys in and just like, hey, mayors, what are the problems in your village? And you tell them things like, man, people are hungry, they're lining up, they need assistance, because I don't know if they get it or they hear it or they know it. And I just think that that's got to be a big part of the conversation, especially if we're told to hang in there and there's nothing left to hang on to.
I hear you. Yeah. But, you know, if anyone has questions, they can call their mayor's offices. And, you know, we'll try to answer to the best. But 311 is a number I tell people to call. Mm-hmm. Also, I can't answer stimulus and tax questions. I can't, you know. So
we know. We know.
Yeah. Hey, thank you, Mayor.
Thanks, Mayor. I hope everything goes well this Saturday.
Sorry about blowing up your phone all day yesterday.
It's okay. I just can't answer questions.
I know. I got you.
Yeah, okay.
Thank you, though,
all right,
Mayor.
you take
Appreciate
care.
it.
You too. Frank.
Okay. Wash your hands.
Okay, that was Dededo Mayor Melissa Savaras giving us some information about the community pilot testing program that's happening Saturday at the Astumbo gym. This is specifically for residents that live around the gym, the Sagan Linadzan area. About 80 homes there. We're talking about 400 to 500 people.
Right.
They're not saying that all 400 to 500 people are going to get tested. What they're specifically looking for are people who have certain symptoms, the cold and flu-like symptoms,
Or
who have-
comorbidities or chronic illness. I think we've got a list of it. We're going to go and get that for
right,
you guys.
These mild symptoms.
Right.